1. A newly licensed medical surgical nurse is struggling with time management. As a mentor, which strategy aligns best with adult learning principles to improve the nurse's efficiency? A. Provide a mandatory time management seminar. B. Assign the nurse to shadow a senior nurse for an entire shift. C. Engage the nurse in setting personalized daily goals and self-reflection sessions. D. Monitor the nurse's activities and give feedback only at the end of the week. 2. A nurse educator is developing a curriculum for medication safety. Which action best ensures the course is aligned with current regulatory standards? A. Incorporate case studies from 10 years ago. B. Include only institutional protocols. C. Review and integrate Joint Commission guidelines and CMS policies. D. Design content based solely on educators' clinical experience. 3. A charge nurse needs to evaluate a new staff member's wound care competency. Which method is most effective? A. Written test on wound care theory. B. Checklist during a simulated dressing change. C. Oral questioning at shift end. D. Peer review with general feedback. 4. During a preceptorship, the preceptor observes a student failing to use PPE correctly. Which response best promotes clinical learning? A. Report the student to the school immediately. B. Correct the student in private and explain infection control rationale. C. Ask another staff to demonstrate proper PPE. D. Ignore it and address later in the day. 5. A nurse presents patient education inconsistently across patients. What mentoring strategy ensures better learning outcomes? A. Provide standardized teaching materials and encourage reflection on their usage. B. Assign another nurse to do patient education. C. Have the nurse observe a physician's approach. D. Require weekly written reports on patient interactions. 6. Which scenario illustrates compliance with CMSRN practice domain standards related to patient-centered care? A. Prioritizing documentation over communication with family. B. Discussing treatment options with the healthcare team only. C. Including the patient in care planning discussions. D. Focusing solely on physician's orders. 7. A nurse notices a colleague consistently documenting late. What is the most appropriate course of action aligned with ethical practice and mentoring? A. Report to HR immediately. B. Offer guidance and share strategies for timely documentation. C. Ignore the issue to avoid conflict. D. Ask another colleague to intervene. 8. In evaluating a nurse's ability to manage complex cases, which method is most suitable? A. Multiple choice test. B. Self-evaluation survey. C. Direct observation during multidisciplinary rounds. D. Attendance at a case management seminar. 9. A nurse educator is revising a diabetes management curriculum. Which principle of curriculum development should guide the process? A. Focus on theoretical knowledge. B. Prioritize institutional preferences. C. Use patient outcome data to tailor learning objectives. D. Avoid feedback from students to maintain authority. 10. When developing communication skills in novice nurses, which instructional method is most effective? A. Silent role play. B. Instructor-led PowerPoint lecture. C. Structured patient interview simulations with debrief. D. Unstructured peer discussions. 11. A unit manager needs to train nurses on a new EHR system. Which adult learning strategy is most effective? A. Provide a user manual only. B. Lecture on the software features. C. Facilitate hands-on sessions with real-time problem solving. D. Assign reading material for self-study. 12. A nurse educator is conducting an evaluation of critical thinking skills. Which tool is most appropriate? A. Multiple choice quiz. B. True-false worksheet. C. Clinical scenario-based simulation. D. General knowledge exam. 13. A new nurse demonstrates difficulty in managing patient loads. What mentoring approach best supports improvement? A. Criticize in staff meetings. B. Assign fewer patients permanently. C. Develop time management plans together with ongoing support. D. Let the nurse handle more patients to build experience. 14. A nurse mentor observes that a mentee lacks confidence in delegating tasks. What response is most supportive? A. Ignore and allow the mentee to develop on their own. B. Reassign mentee to a lower acuity unit. C. Discuss specific scenarios and role-play delegation conversations. D. Encourage the mentee to avoid delegation temporarily. 15. A nurse is asked to present a medication safety protocol update. What strategy promotes adult learner engagement? A. Read the policy document verbatim. B. Deliver a monologue presentation. C. Use interactive case studies and solicit participant feedback. D. Avoid questions to save time. 16. Which method most accurately assesses nurse competency in central line care? A. Attendance at annual training. B. Self-reporting comfort level. C. Direct observation during patient care. D. Completion of online module. 17. A nurse manager seeks feedback about new shift scheduling. Which method ensures transparent and open communication? A. Anonymous online survey. B. Staff meeting without an agenda. C. Posting a notice board. D. One-on-one mandatory interviews. 18. A nurse educator is designing a course on pain management. What should be the primary basis for content? A. Historical nursing practices. B. Physician feedback. C. Evidence-based clinical guidelines. D. Institutional opinions. 19. A nurse is overwhelmed by end-of-life care scenarios. What mentoring method offers emotional support and promotes reflection? A. Provide a textbook on palliative care. B. Allow personal time off without discussion. C. Offer debriefing sessions and mentorship meetings. D. Assign only post-op patients. 20. Which approach best supports staff compliance with hand hygiene protocols? A. Daily email reminders. B. Peer accountability programs and visible feedback. C. Annual policy training only. D. Verbal warnings upon failure. 21. Which technique promotes knowledge retention in adult learners during medication reconciliation training? A. Memorization drills. B. Group case study analysis. C. Reading textbook chapters. D. Independent worksheets. 22. What's the most appropriate response to a staff nurse failing to follow isolation precautions? A. Written reprimand. B. Group discussion highlighting the error. C. One-on-one educational intervention and review of policy. D. Ignore unless patient is harmed. 23. A clinical instructor wants to ensure students apply theoretical concepts effectively. Which evaluation method is most reliable? A. Lecture participation. B. Oral quizzes. C. Simulation-based assessment with scoring rubric. D. Written essays. 24. A nurse leader wants to introduce a mentorship program. What is the first step in development? A. Assign mentors randomly. B. Provide monetary incentives. C. Conduct a needs assessment among staff. D. Launch a website for mentor registration. 25. A staff nurse asks for clarification about a new protocol. What leadership approach demonstrates effective communication? A. Direct them to read the policy manual. B. Ignore the question until the next staff meeting. C. Provide a concise explanation and offer follow-up training. D. Ask a supervisor to handle it. 26. What method best assesses communication skills during a high-stress scenario? A. Review of charting. B. Peer evaluation form. C. Structured role-playing exercise. D. Supervisor anecdotal notes. 27. A nurse mentor encourages goal setting. What element is essential to ensure this strategy aligns with adult learning theory? A. Assigning generic department goals. B. Mandating completion deadlines. C. Ensuring goals are self-directed and relevant. D. Avoiding feedback on goal progress. 28. A nurse educator wants to measure improvement in 4 insertion skills. What assessment is most appropriate? A. Oral questioning. B. Peer review only. C. Return demonstration with competency checklist. D. Patient satisfaction survey. 29. A newly hired nurse avoids difficult patients. What mentoring action promotes growth? A. Criticize avoidance behaviors. B. Encourage and gradually increase patient complexity. C. Assign easiest patients permanently. D. File an incident report. 30. Which instructional strategy best meets diverse learning needs during a sepsis training? A. Lecture-only format. B. PowerPoint with minimal interaction. C. Blended approach using video, role-play, and case analysis. D. Policy handouts. 31. A nurse struggles to explain discharge instructions. What's the most effective remedial action? A. Require the nurse to memorize protocols. B. Provide scripts to read aloud. C. Conduct role-playing sessions with coaching. D. Limit the nurse's discharge responsibilities. 32. Which behavior best demonstrates regulatory compliance? A. Changing documentation to match physician orders. B. Following standard protocols for restraint use. C. Sharing patient updates in the staff lounge. D. Skipping double check on high-risk meds. 33. How can nurse leaders best sustain changes after a quality improvement project? A. Assume staff will adapt naturally. B. Distribute a memo and move on. C. Implement feedback loops and monitor performance. D. Avoid discussing changes to reduce resistance. 34. What strategy most effectively teaches therapeutic communication? A. Watching instructional videos passively. B. Role play with real-time feedback. C. Studying theoretical frameworks alone. D. Lecture on terminology. 35. A nurse is mentoring a peer through clinical reasoning development. What's the best approach? A. Assign more patients. B. Use Socratic questioning during case reviews. C. Offer weekly tests. D. Reduce workload temporarily. 36. What's the best way to incorporate evaluation into a training course? A. Rely only on pre-post knowledge tests. B. Add simulation performance and self-assessment tools. C. Eliminate evaluation to reduce stress. D. Use only attendance as success measure. 37. Which evaluation method helps identify practice gaps in medication administration? A. General Nursing Satisfaction Survey. B. Chart review and direct observation. C. Self-rating checklist. D. Time motion study only. 38. How can a nurse educator ensure learners transfer skills from simulation to practice? A. Provide feedback after months of observation. B. Require written reflection and link simulation to real-world tasks. C. Allow learners to skip simulation. D. Grade only the simulation performance. 39. A new nurse demonstrates unsafe 4 technique. What's the first step a mentor should take? A. File a safety report. B. Remove the nurse from 4 tasks permanently. C. Provide immediate corrective feedback and schedule retraining. D. Discuss it at the next department meeting. 40. How can a manager encourage feedback from staff on a newly implemented policy? A. Schedule informal feedback huddles. B. Post a policy without notice. C. Require email responses within 24 hours. D. Avoid feedback to prevent negativity. 41. What technique best supports critical thinking during patient deterioration scenarios? A. True, false quizzes. B. Real-time clinical simulation with post-briefing. C. Video lectures only. D. Shadowing another nurse. 42. A nurse continually interrupts patients during interviews. What mentoring method encourages improvement? A. Role-playing and observation with feedback. B. Lecture on communication styles. C. Assign reading on empathy. D. Ignore the behavior for now. 43. A nurse leader is establishing expectations for bedside shift reports. Which action best aligns with communication best practices? A. Allow each nurse to decide their approach. B. Use a structured SBAR format. C. Skip patient involvement. D. Focus solely on medication updates. 44. A new hire lacks familiarity with pressure injury staging. What evaluation tool best determines knowledge retention? A. Simulation with wound models. B. Verbal questioning only. C. Shadowing a wound care nurse. D. Written policy review. 45. What's the most appropriate evaluation strategy for a workshop on fall prevention? A. Participant self-rating scale only. B. Real-world observation and fall rate monitoring. C. Quiz with unrelated questions. D. Satisfaction survey only. CMSRN Clinical Practice Domains Test. The CMSRN Clinical Practice Domains Test is a specialized assessment designed to evaluate the knowledge, judgment, and application skills of medical surgical nurses in key areas of clinical practice. This high-stakes exam focuses on core competencies across multiple domains including pathophysiologic conditions, patient and family education, pharmacology, symptom management, and safety and infection control. The test also integrates principles of evidence-based practice, regulatory compliance, interdisciplinary collaboration, and patient-centered care. Developed to reflect real-world scenarios, it measures a nurse's ability to think critically, communicate effectively, and deliver safe, high-quality care. The CMSRN Clinical Practice Domains Test ensures nurses meet professional standards and are well prepared to mentor peers, evaluate care, and lead in diverse clinical settings. Here are the top 5 beneficial uses of the sample exam. 1. Validates competency. The CMSRN Clinical Practice Domains Test confirms a nurse's ability to apply critical clinical knowledge and skills, ensuring safe, evidence-based care delivery in medical surgical settings. 2. Promotes professional growth. Earning CMSRN certification through this test demonstrates a commitment to continued learning and excellence, enhancing professional credibility and career advancement opportunities. 3. Improves patient outcomes. By evaluating proficiency in symptom management, patient education, and care coordination, the test ensures nurses are equipped to make informed clinical decisions that directly benefit patient safety and recovery. 4. Strengthens regulatory compliance. The exam assesses knowledge of safety standards, infection control, and documentation practices, helping institutions meet accreditation and legal requirements. 5. Enhances mentorship and leadership. Certified nurses are better prepared to mentor new staff, lead quality improvement efforts, and serve as role models within interprofessional teams.